As the temperature dips and more respiratory viruses circulate, medical experts say seniors remain among those most at risk of dire outcomes.
During last year's flu season, for example, roughly half of all outbreaks were in long-term care homes. And when it comes to COVID-19, 9 in 10 deaths so far have been among Canadians aged 60 and up. So here's what older Canadians need to know.
We'll just have you in here.
Physicians say vaccines can be a key way for seniors to protect themselves from serious illness.
Seniors tend to be more vulnerable in cold and flu season because their immune systems are not as strong as younger people.
There are 4 key vaccines available for seniors this fall for COVID, influenza, bacterial pneumonia, and respiratory syncytial virus, or RSV.
Let's start with COVID. Those shots have been updated to better match circulating virus strains.
Health Canada has already approved mRNA vaccines from Pfizer and Moderna, and a third option from Novavax is expected too.
A second key vaccine, the annual flu shot.
Those doses are now rolling out as well, plus some provinces offer enhanced versions for high-risk seniors, which offer even better protection.
Number 3, there are also multiple approved shots to protect against bacterial pneumonia.
The condition happens when certain bacteria get into the lungs. The most common is pneumococcal pneumonia, caused by Streptococcus bacteria. Canadian data suggests the death rate is typically up to 7% and even higher among the elderly.
Number 4 on the list is new this year, Canada's first vaccine for RSV.
It was approved in August for adults 60 and up to combat a virus that can lead to serious lung infections. And while RSV hospital admissions among seniors happen less often than for other diseases like COVID or flu, recent U.S. data showed they're typically linked to more severe disease and ICU stays.
It's only approved for the elderly.
This pharmacist says with so many vaccine options to protect seniors this fall, some Canadians might be confused about what's available.
So if you have questions regarding coverage on different vaccines, especially the ones for respiratory illness, it would be very important for you to have a dialogue with your pharmacist. Your local pharmacist can typically guide you through this. I know it's a bit of a labyrinth, if you will.
The challenge now for many seniors could be affording some of these shots.
COVID shots are free for all Canadians, and basic flu shots are too, though in some areas you might have to pay for enhanced options. When it comes to pneumonia shots, eligibility for a free vaccine depends on the province and the product. And for the brand new RSV vaccine, experts expect most seniors will have to pay out of pocket. Bradford, Ontario resident Walter Armstrong already has asthma and wants to avoid catching RSV.
I am at a very high risk if I was to get RSV. If any complication with that would, be the equivalent of a death sentence.
But he was shocked to learn he'd be shouldering the cost of more than $200 for the new vaccine. Tough for Armstrong on a tight monthly budget.
I won't have it this month. I won't have it next month, next year, never. So
his question now:
why the government is not covering this at $256 when we know if a person is hospitalized for up to 5 weeks and on a ventilator, the cost is tens of thousands of dollars.
I just wanted to check where you're at with things.
This geriatrician hopes the RSV shot is eventually covered, but in the meantime, he worries those cost barriers could discourage some of Canada's most vulnerable.
A lot of people right now can't make ends meet, and so how are they going to even undergo this vaccination?
Medical experts say the bottom line for seniors is get all 4 vaccines, if you can, to give yourself the best shot at staying healthy.